Intranasal drugs, desmopressin, calcitonin, and esketamine. Inhalation drugs, salbutamol. The highest oral bioavailability is in levofloxacin. All drugs are bioequivalent except phenytoin. Acidic drugs, aspirin, barbiturates, methotrexate. Basic drugs, the drugs ending in -ine, like atropine, morphine, and amphetamine. Drugs that can be removed by dialysis can be remembered by the mnemonic MLA: methanol, lithium, and aspirin. Dialysis is not effective in avoid, which means avoid dialysis in these drugs. Amphetamine, verapamil, opioids, imipramine, and digoxin. Thalidomide can cause teratogenic effects like C-limbs or phocomelia. Two drugs which do not cross placenta are insulin and heparin. Aplasia cutis congenita is an teratogenic effect caused by carbimazole. Chloroquine has highest volume of distribution. Prodrugs can be remembered by the mnemonic: all prefer doing MD in clinical subjects. All stands for ACE inhibitors except captopril and lisinopril. Prefer stands for proguanil, proton pump inhibitors, and prednisone. Doing stands for dipivefrin. M stands for methyl dopa, minoxidil, and 6-mercaptopurine. D stands for levodopa. Iron stands for irinotecan. Clinical stands for carbimazole, clopidogrel, cyclophosphamide. Subject stands for sulfasalazine and Sulindac. Rifampicin is an enzyme inducer and cimetidine is an enzyme inhibitor. Inducers can be remembered by the mnemonic GPRS cell phone: griseofulvin, phenytoin, rifampicin, smoking, carbamazepine, phenobarbital. And inhibitors can be remembered by the mnemonic vitamin K can't cause enzyme inhibition: valproate, ketoconazole, cimetidine, ciprofloxacin, erythromycin, and isoniazid. Theophylline, higher dose is required in smokers because smoking is an enzyme inducer. Most anti-epileptic drugs are enzyme inducers except valproate. Valproate is an enzyme inhibitor. Most antimicrobial drugs are enzyme inhibitors except griseofulvin and rifampicin, which is enzyme inducer. Drugs metabolized by the protein CYP3A4 can be remembered by the mnemonic CT scan: cyclosporin, calcium channel blockers, tacrolimus, statins. C is for cat drugs: cisapride, estomizole, and terfenadine, which have been withdrawn from the market due to QT prolongation caused in the ECG. A stands for amiodarone, and N stands for Navier drugs. Then for CYP2D6, the drugs are beta blocker. D stands for the drugs which are used in depression treatment, like TCA, selective serotonin reuptake inhibitors, and serotonin norepinephrine receptor inhibitors, reuptake inhibitors. And 6 stands for antiarrhythmic drugs except amiodarone. CYP2C9, C clotting antagonist, warfarin. And CYP2C19, C1 can be seen as Cl, which is seen as clopidogrel, and proton pump inhibitors are in, inhibitors of CYP2C19. So clopidogrel and proton pump inhibitors cannot be given together. And for CYP1A1, the drugs are theophylline and procarcinogens. In excretion, the only drug that was given in the notes is probenecid is given along with penicillin to make it long acting. Drugs in zero order kinetics can be remembered by the mnemonic 0 watt power. 0 is for zero order kinetics. Then warfarin, alcohol, aspirin, theophylline, tolbutamide, and phenytoin. And this is the end of the pharmacokinetics.